we have Dr. Orode Doherty, who is the medical director and CEO of Ingress Health Partners, founder of the African Children's Hospitals Foundation. She's an experienced pediatrician, public health physician with focus on integrated community healthcare with women at the entry point into healthcare. A primary health advocate and practitioner with special interest in integration of public systems, including health and social welfare, and the role of the private sector in long-term sustainable development. She's an expert in proposal curriculum development, experienced in program and project management. I hand over the reins to her for the next 30 minutes to teach us and just talk to us about practically the why and the how of breastfeeding, making it a rewarding experience. We had a demo a few days ago and it was just lots of fun, you know, talking about all the misconceptions and ways to really support women to have a successful and rewarding experience with exclusive breastfeeding. We're going to stop sharing our screen now and warmly welcome Dr. Orode, who will take over by sharing her screen. Over to you, Dr. Orode.
It's working. I'm using my phone. Yeah. Am I young?
Hi everyone. Sorry, we have a few co-presenters.
Gentle reminder to everyone to please stay muted if you're not speaking. Thank you. Over to you, Dr. Doherty.
Thank you. And it's our way, so we are not annoyed. So it's very exciting to be here. Thank you very much, Kendra, for that very generous introduction. And thank you to mDoc Healthcare for continuing to do what it is you do so well that allows the rest of us to focus on some of the other things that we derive so much pleasure from. So I say to people that I'm part of an ecosystem that allows us to, everybody is able to do what they're wanting to do, right? Because everybody's doing what they're doing. And so it's really a pleasure to be here. So we'll start by defining exclusive breastfeeding for the purposes of just getting it straight, because the talk is the why and the how of exclusive breastfeeding. So why do we want to do this thing? And when we are doing it, how is it that we do it and ensure that we're doing it well? I'm going to keep an eye on my time. So the WHO, the mother of all healthcare sort of institutions, defines exclusive breastfeeding and says that it's breastfeeding on demand, giving no other food or drink, not even water, with a caveat that infants can still receive oral rehydration salts, drops, and syrups. And the reason is simple. In some parts of the world where they do not have vitamin D levels to boast of, there are people who need to take vitamin D, babies who need to be given vitamin D drops in the first few months of life. And so we give a caveat for syrups, vitamins, minerals, medicines, and so on. Baby has pneumonia doesn't mean that she's no longer being exclusively breastfed. So, very quickly, some of the things that we talk about is breast milk is perfect, it's easily digested by the baby, efficiently used by the body, it protects the baby against infection. But for moms who exclusively breastfeed and for whom their periods have not returned, in the first 6 months of life, it can help to delay another pregnancy. It also protects mom's health, and we'll see more about that later. Certainly, it costs less than artificial. Don't miss out on it. And the reason why WHO and the rest of the world says, why should we exclusively breastfeed, is because on a population basis, exclusive breastfeeding is the optimal way to feed infants. So we know that breast milk is enough to meet with all of a baby's nutrition needs in the first 6 months of life. And so if the baby has nothing else but breast milk, no water, the the baby's nutritional needs will be met. So it is also the best first milk. So some babies are not going to be exclusively breastfed for whatever reason. And they still deserve to get the first milk that their mothers produce. And it's really important to talk about this because I still, in 2021, come across mothers who discard their first milk. And so it's important that we are clear about the first milk is very important and should be given to the baby. Obviously, because it doesn't require additional equipment until you return to work, it can be done very easily and anywhere. And once you get on top of it and you get the hang of it, it becomes easy. It is not easy to start with exclusive breastfeeding when you begin to meet with the roadblocks, but it's certainly easier to do once you have the hang of it. And so we're going to talk about one of the definitions we spoke on in the poll. And this is a quote from the Lancet in 2016 when they said, in fact, exclusive breastfeeding initiated within the first hour of life and continued for at least 6 months is considered the cornerstone of child survival and child health because it provides essential nutrition and immunization against a range of infections and life-threatening ailments. And we say the first hour of life because studies have shown that women who begin to breastfeed within the first hour of life are the ones who are most likely to exclusively breastfeed until the age of 6 months, until their babies are 6 months old. And it is those children who tend to have the better morbidity, mortality outcomes, i.e. being alive at the end of 6 months, having gone through those 6 months with the least number of them being sick. And that forms the basis of this statement. And not only the nutrition aspect, but also the immunization aspect against life-threatening illnesses. So why do we say that, you need tips for successful exclusive breastfeeding? Simply because, like I said, it is not easy to exclusively breastfeed. And every mother who has exclusively breastfed will, if she's being honest, tell you that she had a few, days when she decided, I've done my best and I can give up now and I won't have done my baby a disservice. But the reason we say we persevere and we encourage our moms to persevere, and I persevered through residency twice with 2 babies, and the third baby, thankfully I was working and I could do some of the things I'm going to talk to you about today, is that the babies who get breastfed tend to be able to hold up through the difficulties of infancy when they start to meet these life-threatening infections. The first thing is your decision, because a lot of this happens at the level of the mind. Your decision is an important milestone. So that decision to exclusively breastfeed, followed immediately by a plan for successfully exclusively breastfeeding. I'm choosing my words carefully because we'll go into details. And then educating yourself around exclusive breastfeeding. What does it really look like? What does it entail? And how can you make it successful? So you got to arm yourself with useful information. You got to surround yourself with resources, i.e. people and things that help you succeed. People who have gone before you, people like myself, people like Dr. Briggs, people like Dr. Kendra, who have gone through it and who plowed through whatever form of difficulty. And we'll talk about the various forms as we go on. And then access to resources in case you run into roadblocks. So any nurses in the room, we rely on you to be the first encounter in the delivery room with a resource that will support exclusive breastfeeding, and especially meeting the need of the mother to engage her baby in the golden hour. Lactation experts and consultants come later, but the nurse, the midwife, and the mother-in-law, sister-in-law, bestow, whoever is there in the delivery room, along with the father of the baby, are really important resources because they are physically present, and you want them to be supportive of your intention to exclusively breastfeed. And then, of course, additional support. And we'll talk about getting a little help from our friends. For those of you who are Instagram savvy, yes. And then for those of us who use the good old tried and trusted pack and Ogibaba, we'll talk about those. So I talked about the decision. Decision is important. If you prepare and you plan and you make up your mind, you will do things that other people will think, are you the first? But it's important because if you don't, you will run into the roadblocks that will make you give up. Sleeping arrangements are very important. Some daddies don't like being woken up at night. Some daddies are light sleepers and they have to get to work and they have to drive out early. So they'll tell you, look, this thing is not working. So ahead of time, have planned, knowing how it's going to be. If you have time off, 5, 6 weeks, 3 months, and you can breastfeed in that time, your early sleeping arrangements will be important. Plan ahead. Agree on who's going to support night feeds and who's going to relieve mommy during the day. A baby that is being breastfed is not only the responsibility of the mother of the baby, because breastfeeding is national duty. Your national duty is national assignment. And you will understand why when we begin to do IQ tests and we're looking for people who are going to stand for us, the person that has been breastfed can stand. So consider it national duty and tell them, look, I'm saving you money and I'm saving you trips to the hospital with intractable diarrhea. So everybody has to be on board. One of the first things that one of my aunts told me, she said, anybody that doesn't like the house, the state of the house, give them a broom, tell them to help you sweep or to help you clean. Repurpose the work to be done. Get somebody to come in, a friend, a co-worker who knows how to do one thing or another and supports you with those things. Ensuring that all of the things that you need, the things you like, your comfort foods, your meals, your snacks, water, plenty of water. And we'll talk about lactation support snacks and things. Make sure that they are readily available in the house and that they will be readily available through that period. And as you return to work, the same thing, that those things will be available. Again, a decision leads to a plan. Plan for a good, comfortable place to nurse. Everybody gets ready for the baby to come home. And they have a nice crib or Moses basket, but not everybody makes plans for a comfortable place to nurse. There's an assumption that you will nurse on the bed or on any present chair. It's not always comfortable. You have to make yourself comfortable if you're going to succeed. And then, of course, the decision involves surrounding yourself with breastfeeding supporters, the people who are going to champion you. Your plan will involve ensuring that the resources, these are the physical things now, gel packs, cool gel packs. For those of us who didn't know about cool gel packs, we used wet cloths and left them in the fridge because we didn't have access to the packs with our firstborns. Later on, we did. So you can have a wet, clean cloth that you put in the fridge. You can have cold cabbage that you can prepare, breast pads, nipple cream, nipple shields. These things are important because they are roadblocks. A breastfeeding scarf or wrap for privacy, nursing bras that you can open like this, because it's very terrible when you have to do this. You can imagine the breast is full and it's uncomfortable, then you have to bring this on the wire and do like this. Not fair on you, not fair on the baby. And that underwire too can cause problems. So get 2 or 3 good nursing bras and be ready to wash them very frequently, right? So there should be somebody around that is able to help you even to throw them for soaking, so that when you get into the bath to take a bath, you wash very quickly, you rinse properly, and you hang out, so that in 2 days is ready for you. You will change your bra every day. I assure you. And if you don't, then you are looking for trouble. You are the one, you will feel it in yourself, right? So a breast pump is good to have ahead. It's good not to buy the most expensive breast pump ahead, but a manual one, if you are able to afford, get it ahead, because when we run into day 3 engorgement, which some people do in fact, they run into it by day 2, you want something that can assist you a little bit. I always tell my moms, you see, these ones are fake now because I'm not needing to be breastfeeding anymore. But I like these kind of clothes. I have buttons down the front. So you can undo your button, undo your zip, breastfeed your baby, cover yourself. I see moms, they come with a boo-boo. A boo-boo is nice and comfortable, but you cannot breastfeed in a boo-boo. So when we say, okay, baby needs to feed, then they'll say, I need somewhere. I have to go and hide. Then they'll raise up the whole, can you imagine, the whole shigidin, because you want to breastfeed the baby. It's not fair on you now. They say you born now, not me say everything don't expose. You have to look okay. So something with buttons down the front, or something that has a zip, or something that allows you to do this, breastfeed your baby and cover yourself. Easy to make, easy to prepare, okay? And then you should have back to work plans. And you don't have everything in the beginning, but you know, again, we're talking about success. And success means proper prior planning to prevent poor performance, okay? The golden hour is the first 60 minutes of life. And that time, the baby has just been born, and at that time, they're actually still alert. And it is an easier time than 3 or 4 hours later when they have started sleeping again. It is an easier time to put them to breast. So we refer to the golden hour as the first 60 minutes after birth, when the baby is placed against mother's skin, hopefully for the first time. And it's critical for the initiation of exclusive breastfeeding. And like we said, studies have shown that babies who get that first hour, their moms are more likely to succeed in breastfeeding. I saw a hand go up. My suggestion is you write your question in the chat. This first feed is also important because the baby actually has an intense sucking instinct just after birth. And if you introduce them to the breast in the first hour or 2, but the first hour is the golden hour, that's when you have your greatest success. Now, I know that not every delivery is a vaginal delivery. Not every delivery has the baby coming out and crying with Afghans of 9 and 10 in the first and 5th minutes. But you see, we're talking about the vast majority. And the rest of us, and that's why we're pediatricians, we will be at the delivery and we'll do what is next best to optimize exclusive breastfeeding. But we're talking about most people, sucking instincts, get the baby to go to the breast and give the brain notice that the baby has come out of the womb. And when the baby starts to suckle, it stimulates the breast to produce milk. Also helps with contraction and reducing bleeding right after the delivery. You see, at this time, and the studies have shown it very clear, if you even put the baby on the mother's belly, the baby will migrate towards the breast because of the smell of the areola and the smell of the mother's nipple. The baby will migrate, and the thing to do is to put this baby, not with clothing, but skin to baby, baby skin to mother's skin, so the baby will smell and latch on. It's not always easy, but when it's done, it's so beautiful to behold. And it's just, you know, it's, for me, is one of the wonders of the world. But, you know, not everybody can see, not everybody catches it. I think that the things that are very big, you know, we have a very big God. A big mountain is a big thing. What could you have expected from a big God? But a perfectly formed 5th toenail, perfectly formed 5th fingernail in a newborn, and the ability of the newborn to latch onto breasts. For me, that's mind-blowing. I've never really gotten over those things, right? The frequency of feeding is far more important than the length of feeds in the early days. In the early days, what you want to do is keep telling the brain, the mother's brain, that is, baby is here, you need to feed. Baby is here, you need to feed. It's not so much how much they are getting and the volume that they are getting, because milk really comes in end of second day, third day. In the early days, it's colostrum, and you want to get that in. So here we are, colostrum, and this is the first golden milk. I remember when we were early in practice, we heard that many mothers express breast milk, and you have to teach them, you have to help. But I'm shocked, 20 years later, 30 years later, I'm telling my age, we're still talking about discarding the first milk. I don't understand. And I just want to implore everybody who is ever present at a delivery that they should please remember that the first milk is the best, and is the best for that baby at that moment, and the baby needs to get it. So colostrum comes out in the first 4 days of life. Actually, it's present in the last few days of pregnancy, and some moms will actually be able to express at the end of pregnancy. And it has all the nutrients and fluid that the baby needs. It's got growth factors, vitamin A, it's got anti-allergic things. So all the things that will help the baby become attuned or ready to take on the world in their GI tract, from the mouth all the way down to their anus. The breast milk that first comes out helps to prepare that entire GI tract for life. So it's important that baby gets colostrum. Colostrum also helps the belly move, so that the first dark poo-poo, that black poo-poo we see, called meconium, it moves it along, and it helps to prevent jaundice. So it's thick and it's creamy. It has all of these proteins inside, and it's also thought to be important in the prevention of severe measles and severe diarrheal illness. So colostrum is critical. Critical also is latching on. And I know Matron is here. Matron is the expert on latching on. The nurses, this specific message is for the nurses now on duty, the nurses on call. WHO has said all mothers should receive practical support to enable them initiate and establish breastfeeding and manage common breastfeeding difficulties. I want to implore, and I know many of you here are obviously breastfeeding champions, but you have colleagues outside of this circle whom you really have to engage around ensuring that they practically support mothers. I keep hearing, I had CS, they say I should give baby water. It's been 24 hours. I've seen this in the recent 6 months. I'm not talking from long ago experience. I'm saying in the past 6 months, I've seen a baby who was not fed. I saw her on the 3rd day and nothing had entered her mouth except water unfed. The mother had had a difficult delivery. The mother is the one who came with the baby. She just said she's tired. And truly, she was ill, but she actually walked into the clinic. So the concern is there was a nurse at that delivery and she didn't engage that mother around putting to breast. She said, the nurse said I should just give her water. I know it's not everybody that says they're a nurse that is a nurse. So we have to just help our colleagues in the community. You know, I'm sitting in the community now, right? As much as we can, babies should be exclusively breastfed. Means no water, no soothers, no pacifiers, no bottles until after 4 to 6 weeks. No pacifiers. So that was another question in the quiz. That's actually the worst time to give a baby a pacifier in the first 4 weeks of life. Moms should be ready to breastfeed early. They should be supported. They should be ready to breastfeed frequently. Some babies, by day 2, you just find that on the morning of day 3, you get to the room, the mother and the baby are both asleep. The mother is exhausted. She said the baby gummed me all night. Yes, they do that early. And then they fall into a rhythm, hopefully. And they're ready to feed on demand. And on demand just means the baby is showing signs of hunger and breastfeed correctly. Just for the first timers, it can be unnerving, it can be scary, maybe. But as time goes on, you become comfortable with your baby. We said a good latch is half the battle. A good latch means, when you're bringing baby to the breast, what happens is you do this, I hope you're all looking. You do this, and then the baby starts doing like that. You see that time when they open their mouth, that's the time you bring the baby and put the baby on. Some children will do mouth like this, as if they want to just lick the nipple. Pull the baby back and do the same thing again. Baby will tip her head back, and some of them will still grab on. Then you try and open by pulling the chin down. This lower picture here, we don't want it. This people that are doing as if they are kissing the nipple, that's not what we want. We want a baby to open his mouth. When he opens his mouth, you will notice that his chin is now touching your breast. At the same time, you see his mouth is open like this, not like this. This is very important. The mouth should be open. And then he closes over and covers the nipple properly and takes on a good amount of the areola. Not the whole areola can fit. Some people have a smaller areola they can fit in, but throughout my time of nursing, I don't recall the entire areola always being in the baby's mouth, especially in the first 2 days. First 3 days, no. As they get bigger, yes, definitely. Most definitely you'll see that. So the tongue must be over his lower gum. Not if a baby whose tongue is up is not breastfeeding. I don't know what he's doing. He's playing, he's licking, he's sucking, he's looking for it. But the tongue has to be here and his lips should be out, like this, as opposed to like this. So that's a baby who is latched on. When the baby is kissing, the baby is not latched on. So the latch is important. The position is important. The chest position is immediately after birth. The mother is lying down. You can put the baby on top of you and you just locate the nipple. And if somebody else will be helping you at that time, okay? Cradle position is the one that most of us know. Is the thing you think of as the most natural position, where baby is here like this and the baby's head is in this arm and you're feeding from this breast, right? That's the one everybody thinks about. But when you have a small baby, sometimes what you need to do is hold the breast with this hand, and then the baby is in this hand, the other hand, and then you bring the baby to the breast. Remember, I keep saying bring the baby to the breast. We don't go down with the breast to the baby. When you do that, your back will pain you. You will not be able to feed for long. You'll be uncomfortable. You will dislike breastfeeding. You will stop breastfeeding. Bring the baby to the breast. If it means pillows, if it means raising up your leg, if it means having somebody put something under the baby or under where it is that your hands are going to be, all well and good. Bring the baby to the breast. Don't take the breast to the baby. Of course, many of us had to express. In our time, we didn't have breast pumps early. We learned to express by hand, and you can breastfeed your baby by expression, especially for mothers who have a very big areola. You can, because the milk is there, and you can put it into a cup and you can feed the baby, okay? Some of us had to learn to lie down and breastfeed because when you're on call and then you come back, the baby wants to feed and you want to sleep. Everybody has to learn themselves. So you get into position. The important thing is that when you are breastfeeding your baby, before you don't do it with the smallest babies, you do it when the two of you are old enough to roll away. The baby that is bigger can roll away from you as well, right? Your first 2 months, maybe not. But when you are breastfeeding lying down, what makes it easy is that the baby usually knows how to settle himself. And so he will adjust, and then you will adjust. Sometimes you put your hand under him. Sometimes he doesn't want your hand, and you find that your hand is easier under your own head while the baby is nursing. The underarm position for single baby and for twins is good because you can, if you are somebody who, for example, if you are left-handed and you put the baby like this, you can still do something with the other hand or vice versa, going both sides. The underarm is great for twins as well. People who have who are well endowed can do cross position for twins because everybody can be accommodated over there. I think the thing I like the most about this particular slide is that it does not leave out the mothers who have to hand express. And it's a very important thing because a good number of our moms are not able to directly breastfeed. And you don't want anybody feeling like, because I cannot put the breast to the baby's mouth, the baby is not getting breastfed. The baby is getting breastfed. The baby is getting breast milk. So what's the other half? The other half of the battle is getting baby to become established at feeding, right? So you, first of all, get it right. You get everything right, your position, your latch on, and then, you're getting your regularity. But some mothers find that their babies will feed many times and then stop, sleep for a long period. And some mothers find that their babies will feed almost like on a cycle, 2 or 3 hours, baby will feed again, 2 or 3 hours, baby will feed again. 2 or 3 things are important. Never allow a baby to go more than 3 hours. The baby sleeps through a feed, there's something the matter, you have to check and wake that baby up. But importantly, babies should not be given any pacifier within the first 4 weeks. Otherwise, they develop confusion around which is the nipple. The pacifier and the bottle and the nipple, the mother's nipple, are very different. If the baby comes to understand the mother's nipple first, that baby is less likely to be confused than the baby who understands the bottle nipple first, because they will have difficulty latching on, and then feeding becomes painful. When feeding is painful, we're not likely to successfully, exclusively breastfeed. So we said no extra food for the first 6 months. Some mothers report that by day 2, the baby has started fighting, quarreling, screaming, shouting through the night, put head, and then you come off, and they'll quarrel, and then they'll put head again, and then they'll come off. I say, all that crying and shouting, they are ingesting gas. So 2 things. 1, you should not be alone. Somebody else will be able to take the baby from you and either swaddle the baby and calm the baby, or help to burp the baby so that the gas comes up, and then put the baby back to breast. Day 2 and day 3 for me, they were always the days of decision, because the first one, day 2, she did not leave the breasts overnight. And I had been breastfeeding champion. I was ready to go. But with the second child, he just would take it all in and throw it all up. I said, this one, baby doesn't need my milk. So for whatever reason, the first week, some babies do very well. My third, they just sailed through, although he didn't feed for about 2 days. Was on day 3, he started feeding. But again, you still have, that week to adjust. And I'm saying these things because, I've had these experiences, and I've seen friends who also had these experiences. There's no time when everybody has a perfect breastfeeding time. So growth spurts are important. About 3 weeks, the first one may happen, about 6 weeks, and then at 3 and 6 months. And of course, what happens at 3 and 6 months. So 3 and 6 months, babies are growing. They have a growth spurt and they have a feeding spurt, and they are cranky, and you find they get to this thing again where they just sit on the breast and they don't want to go away. And they're waking up more at night. They just need more food, and that's okay. It just, again, I said, at some point you have to be patient to feed them. So one issue that I'm expecting that people would have heard about or had is engorgement. And this is when the breasts get very swollen and hard about 3 to 5 days after delivery. I looked for pictures of engorged breasts, and honestly, very few of them were not pornographic, so I could not use them in this presentation. But you can see the difference between this breast and this breast. Here you can see all of the lobes and ducts are not quite so full, and here they are full, very full. right? So it's milk in lobes and ducts. And I say this carefully because notice that there's also fibrous tissue. The breast is full and painful, and you can express a little bit. If you do this, milk will come. The way to prevent is to, remember we talked about the golden hour and frequent nursing. Just keep nursing the baby, because in the first few days, the breasts are still a bit soft, and so baby nursing frequently will fill up the breast. But if the baby is nursing frequently, the chances are high that milk will be flowing, and so it will not become engorged. Your bras must be good bras. It must be good nursing bras. Avoid the underwire bras. Get a proper nursing bra that you can open and that gives you good support. Women change their bra sizes, I don't know how many times in their lifetime. One of the times is during breastfeeding. You should massage before you feed, and just sort of help things around a little so that the baby doesn't just come to a sort of swollen big areola that he cannot hold on to. So allow some milk to come out first, and make sure always, if you have your baby to your skin, the oxytocin is being released, and that actually gives a pumping action. And then of course, if it's really full, express before you start feeding. When you express a little bit, it becomes a bit easier for you. Now, when the breasts are hard and swollen and engorged, we say use cold compresses. Some people will say just 15 minutes for the cold cabbage, right? Cold cabbage is said to reduce the pain in the breasts. And why is it important? And I used it for my second because I didn't know when it happened. To be honest, that thing took me by surprise. There was a big gap between my first and my second. So I was quite confused when I had my second for a bit. And I was in the middle of residency. You can imagine my head was in a bit of a different place. But the thing about the cabbage is that you can put it on, and if you are feeling brave enough, you can wear one of those camisoles over it for about 15, 20 minutes. And when you take it off, the pain is a little less and baby can come to breast. Of course, you should also express a little. I truly believe in nipple cream. Breastfeeding is not supposed to be equal to death at breast. It's supposed to be equal to death on the stake. I believe in nipple cream. It is a very important pre-delivery purchase. It may be expensive. You have to look for it. Go into the shops. Make sure you get the original and get good lanolin, Lancino, Medela, whichever one you find, buy it, because let me tell you, it is the difference between life and death when you are breastfeeding. Let me just call it that, because when you use it and you put the baby on the breast, and then you compare it to the time when you don't use it and you put the baby on the breast, you too, you see the difference, and nobody will tell you that the next baby, you should buy it. I'll be even tomorrow morning, you should buy it. It's a very important thing. And every woman I see who says they want to breastfeed, this is the actual only thing I tell people. You must buy this. Every other thing, say you can buy. But I say to them, you must buy nipple cream because it makes the difference. If you're engorged, again, take some pain relief. You can have a warm shower to loosen it, but it's not hot compress on the breast because it actually increases blood flow and is likely to cause more blockage of the ducts. So it's a warm shower, then it starts, when you take a warm shower and you're breastfeeding and your breasts are full, it starts coming out, then it becomes easier to flow a little bit. But if you apply a hot compress, now it was not okay. Cabbage worked for me. So getting a little help from our friends. For the internet savvy people, for the internet savvy people, you may know Instagram, all these wonderful things, Milky Express, Titilayo Medunye has told her story about how she really had a terrible time breastfeeding her first, and she needed a lot of help, and it has become her life mission to ensure no mother suffers like her. There are a lot of people now who are producing lactation cookies. I see them in Ebano. I see them in some of our local supermarkets. You can get tiger nut meal swallow. Again, it helps. Quaker oats, drink a lot of water. Carrots, definitely very helpful. But importantly, these things are all available in your kitchen. Tiger nuts, all of you know Ofio from when we were small children. Moringa, almonds, ginger, garlic, they help boost your milk. I have not used garlic personally. I don't know what it would be like, but I don't think it is something that you chew garlic alone. I think that it's those garlic shakes that people make. They put a bit of garlic in something that they are drinking and helps, right? Garlic is not something that you take in large quantities. But for me, the good old-fashioned Ogibaba pap was, in fact, I drank pap every day when I was breastfeeding all my babies. I just had pap in the morning, pap in the afternoon, pap in the evening, because I needed to be able to express. And I would have Ogibaba today, regular corn pap tomorrow. I just went back and forth. But these are all milk supply boosters. And there are many things. I mentioned carrots. Some people will even make a carrot drink and take to work. So speaking of work, preparation, like I said, is key. I think on our last slide, it's important, like I said before, to have home support. You can't get away from storage. A fridge is essential. Some of the late arrival at work and early release policies are very helpful for us. You can come in at 10 and leave by 2 or 3 or whatever. Important for you to continue to do. I really believe in maternity leave. And I love the countries where they have it for 6 months. It's not always possible, but I certainly am an advocate of a creche at work, or a room where a mother can go and have her nanny and her baby be comfortable throughout the workday. When you don't work with a large organization, you can certainly help set up a creche. And we've set up a few creches as we've gone along. I think some of my creche people are on this call with me today. You need a pump. As time goes on, you need milk bags. You need to be able to have some of those little lunch boxes that you can put pure water, iced pure water from home, and to keep your milk during the day. You certainly need somebody at home to help you. If your spouse is your partner, for me, my husband was he was the one who used to drive, bring the baby, I'll nurse after when I'm on call, and then I'll pump and then give him all what I pumped during the day, and he'll take home with the baby. And we did that 2 residency trainings, and to the glory of God, I was able to exclusively breastfeed. You need somebody who is committed. You need somebody who believes in it and who sees the difference in the costs, because it makes a difference when they can see the difference in cost. Take a boost drink to work. I say take your pap or take your carrot drink or whatever it is. If you're a ginger chewer, take it along with you, because it makes a difference.